Ever had a journey ruined by a sudden wave of nausea or dizziness? You're not alone, that's travel sickness, and it affects many of us. Also known as motion sickness, this condition is marked by symptoms like nausea, dizziness, sweating, and even vomiting. They can strike during any form of travel, be it by car, boat, plane, or other modes of transportation. But why does it happen? It's believed these symptoms result from a conflict between what your eyes see and what your inner ear, responsible for balance, senses. This mismatch can lead to confusion in the brain about your body's position and movement, causing that uncomfortable feeling of travel sickness. And it's not just about unexpected or unfamiliar movements. Even activities like reading a book or looking down at your device can exacerbate the problem. But don't worry, we have some tips to help manage this uncomfortable problem. Firstly, where you sit during your journey can play a big role in managing travel sickness. In a car, you'll want to snag the front seat and keep your focus on the horizon. If you're flying high in the sky, aim for a seat over the wings where motion is less pronounced. These strategic seating choices can help minimize the unsettling conflict between your visual and vestibular inputs, thereby reducing the likelihood of motion sickness. Choosing the right seat can be your first step in combating travel sickness. Next, let's talk about where to look and how to breathe. It's all about finding balance. When you're in motion, your eyes and your inner ear can sometimes send conflicting signals to your brain. This conflict can trigger symptoms of travel sickness. One way to help resolve this conflict is by keeping your gaze fixed on a distant point or the horizon. This stabilizes your visual input and reduces the chance of a sensory mismatch. Now let's talk about air. Good ventilation is key. Fresh air not only keeps you comfortable, but can also help alleviate symptoms of travel sickness. If you're in a car, crack open a window. On a plane, adjust the air vent above your seat. Adequate ventilation can make the world of difference, especially on longer journeys. Remember, fresh air and a steady gaze can be your best friends on any journey. What you do and consume before and during your trip also matters. Reading during travel, for instance, can heighten your motion sickness. When your eyes focus on the still pages of a book, it sends conflicting signals to your brain about your body's movement, potentially causing discomfort. Swapping out that novel for a distant horizon can help maintain a stable visual input. Hydration is another key factor. Dehydration can amplify those unpleasant travel sickness symptoms, so keep a water bottle close. But avoid heavy meals before your journey. They can make you feel worse. Now let's talk about ginger. This root has been a trusted companion for many travelers. Its anti-nausea properties can help soothe an upset stomach, making your journey more comfortable. Ginger comes in various forms: candies, tea, supplements. Choose what suits you best. So, keep your eyes up, your water bottle filled, and maybe bring along some ginger candies. There are also specific methods and medications that can help manage travel sickness. One such method is acupressure. Acupressure wristbands, widely available and easy to use, apply pressure to specific points on the wrist associated with nausea. By stimulating these points, some individuals find significant relief from travel sickness symptoms. On the other hand, there are also over-the-counter and prescription medications that can be effective. Antihistamines, for instance, are commonly used to prevent or relieve motion sickness. They work by blocking the signals to the brain that trigger feelings of nausea, dizziness, and other discomforts related to travel sickness. However, it's important to note that medications are not a one-size-fits-all solution. What works best for you will depend on your individual symptoms, overall health, and any other medications you may be taking. Just remember, always consult a healthcare professional before starting any new medication. Now let's talk about what to limit and how to prepare. When it comes to travel sickness, some of our favorite beverages might not be our best allies. Alcohol and caffeine, while they may seem like good ideas at the time, can actually exacerbate the symptoms of motion sickness. Both of these can contribute to dehydration, which in turn can worsen the feelings of nausea and dizziness associated with travel sickness. So it's best to limit your intake of these before and during travel. Now, on to preparation. Just as athletes train their bodies to handle physical stress, you can train your body to handle motion. Gradual exposure to the type of motion that triggers your travel sickness can sometimes help your body adapt. Start small, with short trips, and gradually increase the duration and intensity of the motion. It's a bit like conditioning your body to understand that this motion is normal and not a cause for alarm. In short, go easy on the drinks and take it slow. Lastly, let's delve into the world of homeopathy for some potential remedies. Homeopathy is a holistic form of medicine that takes into account a person's unique set of symptoms, constitution, and overall health. For travel sickness, there isn't a one-size-fits-all remedy, but there are several options that homeopaths may consider. Cocculus indicus, for instance, is often indicated for those who experience extreme nausea from motion and a feeling of emptiness in the stomach. This remedy might be particularly useful if symptoms are aggravated by looking at moving objects or sitting in a moving vehicle. Tabacum is another potential remedy, particularly suitable for individuals experiencing intense nausea, pallor, and cold sweats during travel. It's interesting to note that symptoms may worsen from the smell of tobacco or strong odors. Nux vomica is considered for those with nausea and a headache, particularly after overindulgence in food or stimulants like coffee. It seems that emotional stress or overwork may also aggravate the symptoms. Petroleum is indicated for nausea, dizziness, and vomiting during travel, especially in cars. This remedy might be particularly useful if symptoms are worse in warm conditions. Borax, on the other hand, is used for individuals who experience motion sickness aggravated by downward motion, such as going downhill. Remember, these are just possibilities. Homeopathic treatment should be individualized, and a qualified homeopath can guide you in selecting the most appropriate remedy for your unique symptoms. Again, it's essential to consult with a qualified homeopath for personalized advice. So, we've covered quite a bit about managing travel sickness. From choosing the right seat and focusing on the horizon, to ensuring good ventilation and avoiding reading. We've touched on staying hydrated, the benefits of ginger, and the use of acupressure and medications. We also discussed limiting alcohol and caffeine, preparing your body, and explored some homeopathic remedies. Remember, travel sickness is common, but with these tips, you can make your journeys much more comfortable. Safe travels.